Mark, thanks. May is Mental Health Awareness Month, and it's important to check on your friends and your family to make sure that they're okay, as 1 in 4 Americans suffer from a diagnosable mental health issue. Here to tell us about it and give us some more insight on mental health is Dr. Tim Perry with Frontier Health. Thank you so much for joining us today.
Absolutely.
Well, first off, what is considered to be a diagnosable mental health issue?
When the symptoms of the disorder affect your daily functionality, if you're not able to function daily, you're not able to cope with whatever the symptoms are, then that really reaches the level of diagnosis. That doesn't mean that those issues aren't something that needs to be addressed. Not everything that is diagnosable is not something that needs to be addressed. We also need to address those because many times those symptoms can develop into something more severe that needs a diagnosis and treatment.
What are some signs that people should look out for, not only for themselves, but others that may be suffering as well?
I think you'd start out with just the things that change in daily routine. For example, difficulty sleeping, change in eating habits, change in eating pattern. If they're experiencing mood shifts that are frequent, if they feel overwhelmed and anxious most of the time, if they feel their emotions are so out of control they can't bring them in and control them, if they feel overstressed, if they're feeling depressed, especially if they start making statements like, I don't think I can cope any longer. I don't think I can go on anymore. This is too much. I don't know how to deal with this. It's overwhelming me. Those are some signs to look for that could be someone struggling with a behavioral or mental health problem.
And what should you do if you start to notice this within yourself or within someone else?
The first thing is always reach out for help. There is no harm or no weakness in someone reaching out to ask for help. We all need that from time to time. Just the support of someone to help give us some encouragement, give us some guidance, a professional that can actually give us some tips on how to deal with the daily life functions that sometimes become overwhelming for us. So reach out for help. If you feel that you're afraid, and sometimes stigma gets in the way of that, the fear of being labeled or the fear of being judged, don't let the misconceptions or misapprehensions about mental health bury you from getting the services that you need or prevent you from getting that help. Take care of yourself. Reach out for that help. Get someone to assess, see what's going on, and give you some guidance, and your life can be much better for it.
Absolutely. Well, Dr. Perry, thank you so much for coming on and talking about this very important issue this month. And of course, for more resources on mental health awareness and a variety of other topics, you can call Frontier Health. That number is there on your screen. You can also reach out to them via email. That's also on your screen as well.